Hey, I hope you're doing well there. It's Dr. Matt here. I actually wanted to touch base today on whether you're prepping yourself to lift, to work, whatever it may be, in that stiff, achy, low back. So I wanted to give you some ideas on some things you can practice, some things that you can better prepare yourself with, and a little bit better understanding of your body so you can get more out of day to day. And remember that when you go from, let's say you're driving to work or a work location, or you're driving to the gym and you've been sitting most of the day, think about this, right? So your spine, more ideals, posture like this, and then all of a sudden you spend all this time like this, right? And as your family chiropractor, or as your family corrective chiropractor, I want to know about, sure, if you have some discomfort down here, right? But I also want to know if you're shifted, right, and stuck and any of those nerves are irritated. So some of the areas may be down here, but you may be compensating above and below. So it's really important to know what's going on, because all this information from your brain travels all the way down to your muscles, your organs, and has to send messages back up. And part of that system is what we help make work better, so that you can get more out of your day and you can heal and work and function that much better. So consider the health of your spine and nervous system, and consider some of those practice things that you can do throughout the day, right? Now, some of the things I keep in mind is if you spend all your time like this, seated, and then you get up to a job site, it literally may be like a little workout. So you go from 0 to 60 all of a sudden, and you push yourself too much. You want those muscles to be in the best shape and those joints to be in great shape, and you want your brain-body awareness to be high so that things are working at their best. So I think about hip hinging, right, the soft tissue ball, and one exercise I would not live without. Right? And the hip hinging comes down to teaching yourself how to move properly, and then doing it in the gym, but also doing it when you are in your day-to-day activities, which can be hard, but it takes practice. Right? So what I'm going to talk about is the hip hinge, the soft tissue ball, and then a simple exercise that I would use every single day, and also that I would do as a warm-up at the gym, especially if you're going to do any gym movement, but anything that involves hip hinging, bending over, deadlifting, squatting, snatching, this is an ideal one. So think about your hip hinge first of all, and your day-to-day movement patterns. I'm going to bring you down here just so you can see a bit better. But your day-to-day movement patterns should look more like this. I'm going to tilt you down, right? And what I'm thinking about every time I lean over, especially when I'm working with patients, I'll be leaning over much of the day, is I'm thinking, how can I push my big toes down, right? So I'll push my big toes down on the ground a little bit, and I'll push my bum back like this. Right? So this is my natural resting position when I'm going to work with somebody. I try to do one of these, stick my buttocks back, and you want to get out of the habit of doing this, right? You want to be more aware of this and engage your midsection, stick your bum back, and tricks that I find work really well: push your big toe down, open up your knees a bit, and shift your buttocks back. That way there's always tension on the bum, the hamstrings, and you're doing one of these. Now it takes work, it does take work, okay, and practice, and that's why I'm going to show you one of the exercises coming down next, okay? So big toe down, knees open, and pushing your buttocks back. And you're always in this position, right? When you're leaning over working on something, right? Or if I'm working with someone, I'll be thinking about this position. If you're going to pick something up, what does this look like? The start of your deadlift position, okay? So consider your hip hinge, big toe down, knees open, buttocks back, and that's your natural hangout position when you're working, leaning over equipment, working with somebody, whatever it may be, okay? So the exercise I'm going to show you next is you're on the ground on all fours. This is your daily homework, right? I wish I could tell you that the results were maintained if you didn't do it, but they're not, okay? This is something you just got to keep practicing with, and it's no different than any other health activity. It's no different than regular maintenance on your car, oil changes, changing your furnace filter out, whatever it may be. It requires regular upkeep to keep things going, okay? So I'll show you here, and when you're here, all right, this is the basic version to start with, and all I need you to focus on is don't let your hips sway side to side. Keep your midsection stiff. If you can do 4 reps, great. Let's aim for 5 or 6. But if you do 4 reps before you start shifting off, then stop and do the other side. So while you're here, what it should look like, kick out and bring yourself back in. And with this, you're pausing, right? I'll do all one side to start and then do all the other side. Great warm-up like especially before you go to the gym, and as well, this is part of your daily spinal hygiene routine. 2 sets of 5 to 6 reps. And if you've created the habit of brushing your teeth twice a day for the past X number of years, I just do it as before you sit down on the couch at night, or just pair it with brushing your teeth, right? That way you know you're always going to brush your teeth. Do something small for yourself so you can build yourself back up, and you're less likely to break down in the future. So 2 sets of 5 to 6 reps. The other thing is grab yourself a lacrosse ball or a soft tissue ball like this, and when you find yourself stiff and not moving so well, I think this is such an easy thing you can do, or you can do it to loosen up before you lift at the gym. And all you're going to do is just hang out like this. You can hop on your glutes, top half of your glutes probably, maybe a little bit more sensitive. You can hop on your glutes. You can even take 2, duct tape them together so you have a little bit more to work with. And you can work on the glutes, the SI, the tissues around the SI joint, right? And you can hang out, breathe, right? And you may find it really tight and tender, right? So breathe into it. But hang out, and I'll show you where I'm placing it. Right? I'm just placing it right here. So you go down your low back, you feel those 2 dimples, if you will, and top of your glutes, right in there. Breathing, hanging out, okay? So what I would do is do it until it gets a little bit easier, right? And you can work your way. If you have the peanut, right, where the duct tape balls are together, you can lay on your back as well, and you can lay on these tissues here. I would keep it off the bony parts, right? But you can hang out and breathe on the thicker, you can feel like the loaves of bread up and down the side of your spine. Hang out, breathe. And when it gets a little bit easier, go from there. You can make that part of your daily homework, and you can even do it before you lift, do some mobility work before you lift as well. So keep those simple things in mind. Remember, like anything, it's the consistency and the regular upkeep with it that helps you work at your best, okay? Consider the health of your spine and nervous system, and oftentimes, if you end up with, let's say, the ouch down here, you've probably already shifted and started compensating, more than likely. And you're probably compensating above and below, whether it's tight hips, right? Mid-thoracic areas of shift, right? Or as your family corrective chiropractor may say, subluxation, right? And also above. The neck's going to be really important too, because all this information travels up and down for you to work at your best. Anyways, I will talk to you soon. Hope you found that useful. And if you did, I can't do it alone. So if you know someone who would benefit from it, my mission's big, and I can't do it alone. So if you know someone who would benefit from it, please take a moment to click share below, or grab the link and send it to their email directly so that they can get some benefit too. Anyways, I will talk to you soon, and have yourself a great day. Bye for now.